So I'm going live now, and I'm just going to wait a few minutes until a couple people are on here. This is a much less personal topic than I usually do, so I hope people will comment and wave and ask questions, and I'm just getting used to the technology, so I'm going to try to read the questions as they run by. Not so great at it. If I don't get to it, feel free to run them again. So I'm Sheva, you know me. I'm the director of Maze Women's Health, and I'm so excited to be talking about Unorthodox. Oh, Rivka waved, and let's see who. Okay, anyway, I'm looking for people I know here. Hi, guys. Oh, people from my staff are here. Jeanette, I haven't seen you in forever. Okay. Anyway, I'm really excited to be here to talk about this new, it's not so new anymore, this mini-series on Netflix called Unorthodox. More than any other live I've done, I'm getting so much feedback about like, oh my God, I'm part of this community and it's been like so maligned and it's so off and you need to, defend the community, and oh my God, I'm part of this community and it's exactly accurate. And so I know there's a lot of really strong feelings here in the room, and well, not in the room, but on the room here, but I'm hoping I'll do a fair assessment. And the reason that I feel like I'm a good person to talk about this particular series, Unorthodox, is because I run Maze Women's Sexual Health. I'm the clinical director with an amazing staff, and I come on here with my staff regularly, so you can see some lives with some of the other therapists and medical practitioners. And we do a lot of treatment of vaginismus, and that was highlighted on the show, which is why I think I got this barrage of emails and direct messages on Facebook and on Instagram saying, oh my God, did you see it, Batsheva? What do you think? Did you really have vaginismus? Is the community really this awful? I am an expert on vaginismus. I can't say I'm an expert on the Satmar community, but I can say that I have a really unique perspective. First of all, I do see patients, a very wide range of patients from the Satmar community. I see a wide range of patients from the Orthodox community. Just to clarify for you, Maze's Sexual Health sees everybody. We see patients from all walks of life, all different religions. Most people aren't religious at all. But because I am known to be Orthodox Jewish, it makes people more comfortable to come in to talk to us. And other therapists are Jewish as well. We have another therapist who's Orthodox as well. So I have been kind of privileged to work with this community in a way that most people don't have an eye on the community. And I do think it gives me a very wide range and a perspective on this community that other people may not have. So I think it's going to be really, really fun to talk about the series. I wish you were all in the room with me because I know different people have different perspectives, and right now you're going to get to hear my perspective, but feel free to DM me afterwards, and you can yell at me or you can say, yay, Batsheva, or while I'm going on, if you agree, you can feel free to send up some hands or send up some applauses. I really would love, as interactive as we can make this be, I would love this to be. So before I jump in, I'm going to say that I'm going to split this into two parts, this discussion. The first, maybe short part, maybe 10 minutes, I'm going to talk about the Hasidic community that was shown in the series. I'm going to talk a little bit about what that community might look like. I'm going to talk a little bit about how realistic or not realistic I thought the portrayal was. And we'll talk a little bit about that. And then most of this, the next 20 minutes after that, is I will talk about Esti and her vaginismus. And Esti, did I get that right? Her name is Esti, right? Somebody thumbs up me if her name is Esti. I'm almost never sure her name is Esti. Shira Haas is the actress. I also do know that, I actually have connections to some of the actors, so I may, in a future live, bring in one of the actors on. Yes, Esti. Okay, good. I'm getting those thumbs up. Thank you. So, Esti, the protagonist in this series, had something. Was it vaginismus? Was it not? She was kind of diagnosed as vaginismus. And so a big chunk of what I will be talking about is sort of how sex is addressed in those communities and whether she had vaginismus and what might have looked correct or different, or if you were in the community or not in the community. So that's kind of the layout here so that you know what you're getting into. And if you wanted to spend the whole time arguing about like whether the streimels, those hats should have been shiny or not, and whether they sat on the guys' heads, this is not the right live to do that, although there are other lives that are doing that. So let's talk about this community for a little bit. I'm now going to back up for people who don't really know the Jewish community, because I know there's a lot of people on here that are less familiar with the Jewish community. Like any religion, there are people who are, I have my like hot tea here. A friend of mine, Amy Barron, I don't know if you're on here, Amy. If you are, hi. She says to me, you have to slow down, watch out, but take some tea and sip the tea, because nobody can follow the speed that you talk at. The Jewish community, like any other religious community, has a huge range of people in terms of how religious they are, how observant they are, different ways of being observant. So many Jewish people, as most of you probably know, are really not particularly observant, are not particularly involved in the religious community. But then you have people who are involved in the community through the Reform movement, which tends to be the most liberal, the conservative movement, which is also fairly liberal, and then you have the Orthodox community, which is the more observant community. And I count myself in that community, but I am to the left. I am on the less sort of limited community, or I don't know if limited is the right word, but I'm in the part of the community which is I think very observant, but isn't necessarily as engaged with a lot of the minutia or a lot of the very small details or the large details, so that you will find people in the modern Orthodox community, for example, will often be, well, somebody just said it's great that you talk about how quickly you talk, because I know that, guys. I know that. And anybody at any time during this live can send a message saying, you need to rewind. I didn't hear you. You talked too quickly. Okay. So the religious part of the community has people who are like part of my community. I don't wear a wig. I don't wear a scarf. I don't cover my hair. This is actually my hair. I don't wear pants. I do wear pants. I go mixed swimming on a beach. Lots of different people have lots of different observance levels. But as you get sort of into the more, I hate to use the word more religious, but the more observant community, you're going to get communities where you'll see the clothing changes, and then the men's clothing changes, the women's clothing changes. They're more sensitive to modesty issues. They may not swim in a mixed swimming pool. And then there's all the way then when you start seeing men with black hats, you see men who always wear black suits with white shirts. You will often then see Hasidim. So the Hasidim is a specific group or sect within the ultra-Orthodox community. I don't love using the word ultra-Orthodox because I feel like that has some negative connotations, but it's a group that is very community-oriented. It's generally grouped around one particular rabbi. There are many segments of the Hasidic community, and this particular community that Unorthodox is involving is the Satmar community. It is the largest Hasidic community out there. That's where you start, the Hasidic community is where you're seeing the big fur hats, the men wearing long black coats, the women with the shaved heads. We'll talk about the shaved heads, but wear a scarf over their shaved head. They are very, very tight community. There's about 95,000 Satmar Hasidim, I think, in the world. If I get that wrong, if you're Satmar and you're watching, correct me, please. Many in that community do not use the internet. So it tends to be a much more sort of insular community involved, very closely with itself. And like any religious community, there's the pluses and the minuses, and we all know that. And I think what's fascinating is one of the women at my front desk, Amanda, I don't know if you're watching, Amanda. If you are, just say hi. But Amanda once said to me, this is such an amazing community because this community really looks out for each other. They have people who, they have these things called gamachs, right? Where people help each other. So there are people who do all the driving for people because the women in these communities usually don't drive. A lot of the men don't drive either, but the women often don't drive at all. They will subsidize doctors' offices if somebody can't afford it. They will sometimes they will take responsibility for paying for doctor's offices. When somebody is sick or ill or dies, this community is unbelievable with coming through with meals for the family. It's a very, very close, tight community. What happens is, one of the things we often see is that in such a small, tight community, you also have problems, and we all know that, right? It's very insular, right? Everybody kind of knows everybody else's business, and often because the sort of religious mores are important, people can be extremely judgmental of each other, and that can be a problem. So it's a tight community, it's a closed community, it's an insular community, it's a very caring community, but it also can be a very rigid, judgmental community. I'm curious, for people who are in the world and know what I'm talking about, do you feel like that was a fair portrayal? Just give me some thumbs up. So I feel like you feel like that was a fair portrayal. I know that this brings up huge emotional issues for people. Like I have gotten so many direct messages saying this community was so unfairly portrayed in the series. And I'm getting a lot of thumbs up. That makes me feel good. And I also got messages saying this community was perfectly portrayed. I'm in this community and I feel like it was perfectly portrayed. And so what I want to say is, let's be a little bit reasonable here. This is Hollywood, right? This is Hollywood. I mean, I don't know if there's any LDS, Latter-day Saints Mormon people watching, but I can't imagine how they felt when Big Love came out, because that was a show about polyamory, a man who had multiple wives. Somebody just wrote, the chesed and the tzedakah that comes out from the Satmar community is amazing, what you don't see anywhere else. And I think that is true, that the Satmar community, they bring meals to people in the hospital, people who need to keep kosher. It is an amazing community. It also can have some downsides, and does have some downsides, to be fair. So I think we have to remember this is Hollywood, and they were trying to show one extremely dysfunctional family. Now, what they did was they took a family and they sort of put on it all of the problems that can be in the community. And somebody just texted that it would have been really nice if they had portrayed the good part of the community just for a second. And I would argue that I'm not sure that they didn't do that. Like, I feel like the women she met on her way out that sort of stopped to talk to her, they all seemed to like her and say, hi, Esty. I feel like the college teacher, which we will get back to in a minute, was actually portrayed not so badly. But they took a family, and this was a really messed up family. So to use that family as the guide for all of them is just not fair. I will say something that I had one Satmar patient who once said something to me which really rocked my world, and it's a quote I've thought of and used often. I'm sure she's not watching, because she was from a very, 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 very strict family, and she said to me that her mother said to her when she got married, she said, when I got married, my mother said, love this quote, at first you'll do it, that would be have sex. At first you'll do it because it's a mitzvah, because it's a commandment and God wants you to do it. But later in your marriage, you're going to struggle to remember that you're doing it because it's a mitzvah and God wants it from you, that it's a commandment that God wants, right? So at first you're going to have sex because you have to do it. But later it will become so pleasurable that you will struggle to remember that it's a commandment from God. And I just thought that was such a beautiful quote. So I want to say that is one of my favorite things from a Satmar patient that she said to me. Now, I will also say that this patient had 5 kids when she came to me, and it was only after baby number 3 or 4, when she was at the gynecologist, where he showed her where her clitoris was. So the idea that pleasure is a very important piece of this may be something the community does believe in, but it does a terrible job at sex education. And I think, those of us who've worked with people in this community know that. Now, to be fair, none of us really do a good job in sex education. I mean, seriously, even in the secular world, there's crummy sex education. And certainly in the Orthodox world in general, we do not do a great job of sex education. However, I think that this community, what was fair is that in this community, often problems in a family are not addressed so well. And so they're kind of swept under the rug. People are scared of doing it. There is a total lack of sex education, and I'll talk about that either. And the other issues, the issues of the fact that she had to shave her head, we're going to have to leave for. They do that in this community. It is very painful to a lot of the women. There have been articles written about women who leave the community and who really remember the shaving the head really bothered them. And for some women, it bothers them less. But I do think that we need to acknowledge that in this community, very often when problems come up, rather than address them, they kind of either push them aside, don't want to address them. They do a very poor job of sex education, which leaves women frightened and sort of miserable early in their marriage. Now, that doesn't mean they can't ultimately have a great sex life. It just means that it makes a hurdle that's very hard to jump over. So that's where I feel like the series was fair or not fair. And, you know, if there are particular issues you want to talk about, DM me after, maybe we'll do another live. But I really want to shift now to talk about Esty and her vaginismus in particular. So I'm assuming everybody saw this series, right? Like, I'm assuming everybody saw it, right? I'm assuming that's why it's interesting to you. But basically, she tries to have intercourse the first night. Her husband tries to penetrate. He puts the penis there. This is what you think, because there's a blanket over them, and she has excruciating pain. And you see her like like it's just totally painful. And so they try it night after night after night. And honestly, that was not an unfair portrayal, because I get brought the women who can't actually achieve intercourse. And so I've seen it. Like, I've seen it. They have intercourse the first night. It's a big problem. And they just keep trying. And then sometimes that just exacerbates the whole situation. And I'll tell you why. So vaginismus is a condition where there are tight muscles and there is some fear. Now, Esty did not actually exhibit a tremendous amount of fear. To be fair, he put his penis right there and he pushed, and she had pain, right? That was so clear. I have patients where you can't even get between their legs, because they come to us and we need to insert something like a dilator gently, slowly, carefully. We use anti-anxiety, techniques. We do deep breathing. And they just slam their legs shut. Like, there's just tremendous amount of fear. Esty did not seem like she had a tremendous amount of fear. It did seem like it was just incredibly painful. Now, I will say, one could argue, I'm not the expert on the Satmar community, but nobody can argue that I'm not an expert at vaginismus, because May's Women's Health sees probably 1,000 cases. I'm like, that's probably exaggerating, but maybe 200 cases a year of vaginismus. And I always say, vaginismus, you bring me a vaginismus patient, we can fix it. It is not a terrible condition. It is fairly easable to fix, and she had vaginismus. Now, I've gotten a lot of questions about foreplay, and somebody just sent me a question right now about that. And yes, foreplay makes a huge, huge difference, but even without foreplay, it is possible to push a penis in a vagina with some level of pain. It should not be that difficult unless the muscles are cramping down. Foreplay allows you to loosen the muscles and let them be, sort of softer and gentler. But what we were watching on there was not just, it hurts a little and, it's like sort of uncomfortable. And that's really a different story. Somebody wrote, and I did get some DM messages, that that's rape. I would argue with you that that wasn't rape. He wasn't raping her. She had agreed to try to have sex with him. This was their understanding of sex. It was bad. It was a terrible situation. And quite honestly, I feel terrible for him also. Like, we need to understand that this is not just a horrible situation for the woman to be in. It's a horrible situation for the man also. And I want people to be a little bit sensitive to that. I once had actually a Satmar patient who came to me. They brought her before her wedding because she was so scared. It was the most amazing experience, because by the time she got married, she was not scared at all. She was great, and she was happy, and she knew what an orgasm was, and life was great. But I remember, like, maybe a week before her wedding, she said to me, something about him. And I said, well, he's probably really nervous too. And she said, oh, I don't think he's nervous. My college teacher, and I'll go back and talk about college teachers, said for the guy, it's no big deal. Like they just, they could, as long as you lie there and you're okay, they could have sex in any situation. And that is just patently not true. Guys are often lose their erections, are scared to death, don't know what's going on. If they haven't masturbated and they ejaculate for the first time, it's miserable for them. And so I do feel like sometimes we need to be a little bit sensitive to the men. I just need to say that just for a minute, because I know we're focusing on SD, but I do need to be sensitive to the guys as well. Now, let's talk about that kala teacher. What is a kala teacher? For those of you who aren't familiar with a kala teacher. So kala means bride. And every Jewish woman who is observant meets with a kala teacher or kala teacher prior to getting married. And the purpose of the kala teacher is to really primarily teach you about the Jewish laws of Jewish sexuality. They're very, very complicated laws. I think Orthodox Jews have, and I've now worked with Muslims and Mormons and fundamentalist evangelical Catholics, evangelical Christians, and very religious Catholics. And by far, so far, the Orthodox community has the most complicated set of rules regarding sex and sexuality, even when you're married. So for the people who are watching who have no idea what I'm talking about, Orthodox women, from the time that you get your period every month, you stop touching your partner, your husband, for at least the days you're bleeding, and usually 7 clean days after that. It comes out to about 12 or 13 days of no contact at all. Different women on different observance levels keep this differently, so it's not, one size fits all. And then at the end of those 13 days or 12 days or 13 days, whatever it turns out to be, 11, 12, or 13, depending on, how things are counted, you go to a ritual bath. And the ritual bath is a mikvah. It's a body of water which has to be connected to a spring. It's the first thing a Jewish community builds. It's the most important sort of establishment that the Jewish community has. And you go into that mikvah, you get yourself ready with absolutely nothing touching your body, so you're completely naked. You go into the mikvah. There is an attendant who comes in to make sure you're fully immersed. You say a certain blessing, and then you go home and you resume relationships with your husband. So it is a complicated issue, and it is not an easy issue for many women. Honestly, continuous birth control has helped with this, but there are a lot of laws that govern this. And how you, when you start bleeding, how that counts, how you do examinations internally to make sure that you don't have any blood, how you then go to the mikvah. There's so many rules and regulations about this. The men learn about it often with their groom teachers, but the kala teacher is considered super important. You meet with her prior to your wedding. Some, different communities have different standards and different kind of kala teachers, but almost every Orthodox woman meets with a kala teacher. And those kala teachers now have also become people who could be talking to you about sex. Now, in the very religious communities, often they don't, or they just give very minimal information. Like, he's going to put his penis in your vagina. So for many women, they don't even know the vagina is there. And that scene with Esty was not crazy. The fact that she didn't realize that there was a vaginal opening. So that was not an totally crazy scene. I'm looking at the notes. College teacher told her that my first night was more than church. Okay, I can't go into all the details, but the college teacher really did. I think the piece where she sort of explained to her about sex was not so unreal. I mean, there's a huge range. You have some college teachers who are amazing, who go into detail and helpful, and there are some college teachers who just give you the very bare minimum. I had one patient I was seeing for Vaginismus, and this is years ago, and she was from a different community. She was from a Lakewood community, and she said, she came in for pain, but along the way I also taught her about orgasm and helped her figure out how to have an orgasm. And she said to me, why did my college teacher never tell me about orgasms? And I said, sweetie, I don't know. Maybe she doesn't even know about orgasms. And she said to me, Batsheva, that's not possible. She's been married for like 25 years. And I said, yes, it is possible. We all know that there are women out there who haven't had orgasms even in 25 years of being married. So what the college teacher passes along and what the college teacher informs women of is very, very, very varied depending on her personal experience. There's no standard training for this at all. So I actually didn't hate that college teacher. I thought the college teacher was very caring of Esty. And what was fascinating to me was the fact that she sort of diagnosed the vaginismus. I mean, I think that's really interesting. So did Esty have vaginismus? So I would say I don't diagnose over the internet. I do not diagnose over TV shows for sure. But when a woman has that severe pain upon trying to have penetration, that usually is a pretty damn good sign that she has, some variation of vaginismus. And vaginismus is very varied and very wide. She didn't have the fear associated with it, but she did seem to have the tight muscles. And so the college teacher came in and gave her those pink things, which were dilators. And dilators are really nothing other than, this is not a dilator, this is a pen, but they're like sticks that you use in your vagina. They come in varying sizes, and what you're trying to do is let those muscles learn to relax. Now, what the college teacher did not do is say, you need to go see a medical professional. And that was really kind of worrisome because she might not have had vaginismus. She might have had vulvodynia or vestibulodynia or vulvar vestibulodynia. There's a lot of other conditions, but vaginismus is extremely, extremely common because if you don't know your body and if you're anxious, which they are, you hold your anxiety in your vagina. So that wasn't so unusual. What also wasn't so unusual was that the mother-in-law got involved. And I have to say, like, one of the things that I see often in this community is that the whole family, it feels like they're bringing the whole family into their sex life. I mean, I had one patient where her father came in with her. I wouldn't let him come in to the intake room, but again, caring, loving community wants to help, not quite clear about the boundaries of what makes sense and what doesn't make sense. The college teacher did give her lubrication. Somebody just texted, didn't the college teacher give her lubrication? And somebody else asked, can vaginismus go away without outside help? Maybe over many years and maybe having babies, which you could have through artificial insemination or some other way. We've seen that happen. But most likely vaginismus needs to be treated. But vaginismus is totally treatable. It's totally treatable, and we can get rid of vaginismus in 8 to 12 weeks, as that's what it is. Shortest thing, it is so easily treatable, but it needs to be treated, and it needs to be treated both on the end of the fear and the confusion and the education, as well as the muscle relaxation and the dilators. Now, I only have a couple minutes left, and I need to talk about whether she had sex with the guy in Germany, right? When she went off to Berlin. That was, because I kept getting DMs from people. It couldn't have been vaginismus because she had sex with the guy from Berlin. So I personally found that part of her shedding her Satmar identity over the course of 2 days, possibly the most difficult to kind of swallow. I know people who have left that community. You do not run off to Berlin, take off your shaitel wig, take off your stockings, go into the pool, join a group of young people, start having non-kosher dinners at people. To me, that felt sort of very, very forced. But you know what? Again, it's Hollywood. I feel like it's not a complaint, It's not a fair complaint. Here's my question. I'd love to see from people, if you give me, I wasn't even convinced they tried to have intercourse. She had intercourse with the guy from Berlin. She could have had sex with him without having intercourse. That's possible, right? She could have had oral sex or manual sex. There's a million ways she could have had sex with that guy without having intercourse. So I think, if you ask me, my fantasy along here was that maybe she didn't try to have intercourse with him. I was also amused that she was wearing her bra still the next morning. I don't know if anybody noticed that, but I thought that was pretty cute. But I will say something else. If she had worked through the dilators, it is sort of possible that she could have had intercourse with him. And also maybe his penis was smaller, right? The things that go into vaginismus, overcoming vaginismus, have to do with foreplay, for sure. But that's not going to solve it, right? You need to stretch the muscles. You need to do it gradually. You need to start getting your brain and your vagina to speak with each other. I'm getting all these things about, oh my God, you have to save this. I promise I will do another live very soon just on vaginismus. I'll call it Vaginismus Part 1, because there is also Vaginismus Part 2 that is way more complex. But You need to work on those muscles. You need to stretch those muscles. Then you need to get comfortable. So your brain and your vagina are connected. And then you do need to have a partner that you feel loving for and patient for. And it seemed a little unrealistic to me that she meets a guy and then basically a day later or 2 days later, she's having sex with him and it is intercourse and it isn't painful. So again, that felt very unrealistic to me. But again, this is Hollywood. I just feel like that wasn't totally a fair, I don't know that's a fair thing, because for them to show us a 2-year situation where she leaves the community, slowly, gradually develops a new identity, and then hooks up with this guy and develops a lovely relationship, that would be amazing. But, I personally do not have, 23 episodes to watch on this. I think they did a better job on Vaginismus than Sex Education did. And I'm curious how you guys feel about that. If you've seen Sex Education, at least in season 1. I haven't seen all the episodes in season 2. Oh, I'm getting a lot of hearts. Sex Education in season 1 did such a mashup job on Vaginismus. It made me so angry. I was like screaming from the hill. Yes, my staff. I was like storming around because I was so irritated. They had her riding a bicycle down the hill. Like that was going to help because it got rid of her inhibitions or whatever the hell they said. Anyway, so I'm going to leave you with this. I think we have to admit that this was a great, great show. I mean, I think the fact that we're all talking about it and people are really excited about it, like this was a great show. I don't think it was a totally unfair portrayal of vaginismus or sexual problems. I think it was kind of a pretty fair, accurate description. It's hard to get information. In the insular community, it's even harder to get information. If you go in with no information, that's kind of what happens, And vaginismus is incredibly common. And so I don't think that was a crazy. I do think this was a case where vaginismus went off the rails, and that's a bad thing. But I do want to end right here, and I know there's probably hours more of talking to do. I'm just looking to say, right, I'm sort of getting, that was fair. Okay, it wasn't so fair and balanced, but it wasn't trying to be a documentary. Okay, so I'm going to leave you here with a few thoughts. So one is seeing other cultures is difficult, and you need to suspend your disbelief a little bit, and you have to be aware of the fact that you're just seeing one side of another culture and you're not getting a full other culture. You should be left here with this message that vaginismus is incredibly common. There's a story went off the rails, but it is common. It can be easily treated. Even Esty got better, it looks like. But the most important thing here is that support and education is so super critical. So I'm going to leave you with that thought, and I am going to wish you a good night. And I think next week I'm going to be back talking about fantasies and how you can adjust your brain and train your brain to do fantasies, to be better at fantasizing. So maybe next week that's the live that I'll do. And I am looking into possibly getting one of the actors on here with me at some point in the distant future, as long as it doesn't get so boring that nobody's talking about this anymore. Anyway, so to everybody here, thank you so much for joining me. And if you know somebody with vaginismus, tell them to get help because it is eminently helpable. So have a good night, and we'll talk about another Netflix series another time.